Good evening. Welcome to the City of Newark's daily COVID-19 update every Monday through Friday, 5 p.m. on our Facebook Live site. I want to thank all of you, especially the regulars who are always on, who are always putting information out there for us. We appreciate you 100,000% and being ambassadors for us here in the City of Newark. We have a special guest with us today. As I promised you, Honorable Governor Phil Murphy is with us this afternoon. He's going to talk to us about what's going on in the state. And, we are glad to have him. And we're so lucky to have, honestly, 100%, not just because he's here, honestly, to have his leadership, sane, sound leadership that cares about the people of this state and not some of these folks that we see running around the country who are doing things, in my mind, that like defies all comprehension. Today in Newark, we were reported of having 4,563 positive cases of coronavirus, 4,563 and 322 deaths as of today. Our condolences goes out to those families, 322 residents who have lost their lives because of this silent and very ferocious killer that we're trying to do battle with in our entire state, in our country, in this world, actually, that has visited us here in the city of Newark. You know the things that we are doing, and we want you to continue to stay tuned to those things. We want you to stay in the house, as we've always been asking you to do. We want you to wear your mask when you come outside. When you go into these places. I got a request from the water department to tell you not to throw your gloves and your wipes that you're cleaning up with into the toilet. You're throwing them into the toilet, you're flushing them down. It is causing serious sewer damage and water damage to piping in the city. We out here still fixing lead service lines. We're still fixing water main breaks. Every time there's a water main break, you send our guys, they have to come out and fix it. When there's a sewer collapse, they have to come out and fix it. You are exposing them unnecessarily. They have to come out and do these things. All we have to do to help them is not flush the wipes and the gloves down the toilet, not do that, right? If we don't do that, we decrease the chances that they have to go out and service these pipes and sewage lines because of it. So please work with them, work with us to make this happen. And like I said, if you can't discipline yourself to stay in and wear the mask for yourself, do it for your grandmother, your grandparents, people that have compromised immune systems, do it for them. On that note, I'd like to allow the governor the opportunity to get in and just talk to us about what an overview of the state is and whatever he wants to share with us right now before we open up to a little questions.
Mayor, it's great to be with you. Thank you for having me. And more importantly, thank you for your extraordinary leadership. You lead unlike anyone else in peacetime, and you lead even more impressively in war. And that's what we're in right now. So God bless you and thank you and your family for your courage and your leadership.
Thank you.
Folks, it's great to be on. There's no more important community in our state than Newark. So I am very happy to be on this and happy to come back whenever you need me. Just a couple of quick parameters of where we are in the state. Well over 5,000 fatalities. God rest their souls, each and every one of them. Essex County, at least as of yesterday, I can't say definitively today, but Essex County has had the highest death toll of any county in the state. You heard the mayor's assessment of the fatalities in Newark itself. We've got now over 100,000 positive test cases in the state. That's one number that I don't think people should hang their hat on, in the sense that we've been aggressively building up over the past 6 to 8 weeks our testing capabilities. We're now number 4 in the nation, but we're not remotely testing because of what the country wasn't able to do and still can't. We're not remotely able to test more broadly to really determine what's the complete universe of folks who have a positive result. I'll come back to that in a minute. Sadly, we know the fatalities. We know hospitalizations. That's a glimmer of hope. They have clearly stabilized. In intensive care unit beds, we know, and that has stabilized. Ventilator use, we can track to the ventilator, that has stabilized. Those are all good signs. If you look at the heat maps of our counties and they show how long is it taking until the virus can double, those maps look dramatically better today than they looked 2 weeks ago, dramatically. Unfortunately, actually, ironically, Mayor, today they slipped a little bit. And that's a point I'm going to make right now, and I'm going to make it in my press conferences. We can't let up. I mean, I'll be the happiest guy in America if we can open back for business again, but we can't. We just don't have the confidence that when I say hospitalizations have stabilized, that doesn't mean they're at zero. They've stabilized at 7,000 or 8,000 people in the state right now who are hospitalized with COVID-19. That's just a fact. So we've got to not only continue to stay home and please God, and by the way, folks have been extraordinary with this. And we've enforced that, and no one has enforced it more than the mayor, and nowhere has it been more enforced than Newark. And that's because we have to. We have no choice. We've got to stay home. We've got to stay away from each other. And so that's going to have to continue. We cannot let our guard down. We've got to not just stabilize these numbers, but then start to gut them and bring them back down the other side of that curve. And that's what is still before us. Mayor, I'd say a couple of quick things and turn it back to you. Number one, as we're seeing elsewhere in America, the incidences of fatalities among African Americans in particular is running about 50%, 50% higher than the representation of the African American community in our state as a whole. That's obviously troubling and concerning. So, and sadly, given the lack of access to healthcare, given the social determinants of health, given the disproportionate representation of communities of color in our essential workforce, those all add up to that unfortunate reality. That's something that we are looking very closely at, not just in the here and now, but what are we going to do to prevent that from happening again? Senator Ron Rice, Newark's own, and Assemblyman Benji Wimberly were lead sponsors of a bill I signed, I think yesterday, that will now enforce hospitals to come up with a whole range of data, including race, gender, and other demographics. The last thing, Mayor, I'd say is when folks ask me all the time, what has to happen before we can actually begin to open the door? You know, you got Georgia today opening up for business. Please God, they're looking at a different set of facts and science and data than Mayor Baraka and I are looking at, because that is not the case in New Jersey. So what are we going to have to see? Broadly speaking, the curve of people who are infected coming down meaningfully, that hospitalization, ICU, ventilator use coming down meaningfully. Please God, the fatalities coming down meaningfully, although they will lag because these are folks who were infected 2, 3, maybe even longer weeks ago. And then we're going to need healthcare infrastructure in place that we do not have right now because our country wasn't prepared for this. So we're going to have to be able to do much larger scale testing with rapid turnaround. Rutgers, by the way, bless their hearts, are not only leading the state right now, they may be leading the country in the pursuit of that. So at a minimum, we're going to need a statistically significant amount of tests every single day with quick turnaround, number one. Number two, we're going to need a real full contact tracing, both Army and technology in place, so that if you find out that somebody tests positive, you can quickly track down who they were in touch with and make sure you don't allow that to lead to a new case of community spread. And then lastly, we're going to need to we'll need a system where we can isolate folks, if not quarantine them, if they are deemed to be positive. So that's a little bit of a sense of what we're going to need to see. We're not waiting, by the way. We've already got an internal team, and I'm putting together a council of wise women and men who could advise us on this in terms of responsibly reopening and recovering. But it will not be tomorrow. I wish it would be. But folks, bear with us. You're doing an extraordinary job. Don't let your guard down. follow the orders from the mayor, and we'll get out of this, I promise you, Sunday, hopefully sooner than later, stronger than ever before. With that, back to you, Mayor.
Thank you. I'm glad you talked about opening up and the ideas about that. We're getting a lot of pressure. At least I can at least say it's not the pressure they're getting in Pennsylvania, that's for sure. But we getting some just talking, discussion, and I'm glad you mentioned that. But what about the small businesses in our city and around? What advice do you have for them?
Yeah, I mean, they've been crushed. So we put in place the Economic Development Authority, and Aisha Glover, by the way, is a relatively new board member there, and she's doing an extraordinary job. So shout out to Aisha in Newark. Economic Development Authority put a great set of programs in place for grants and loans and other assistance. The problem is it's like the uninsured, Mayor. The boat's been swamped. I mean, the supply-demand imbalance is overwhelming. Now, the good news is the feds, both for unemployed folks and for small businesses, the feds have to come here in a big way. And that's been a lot more complicated than it should be. The good news is they passed a big bill in Congress yesterday, and that was overwhelmingly directed at small business relief. So I would say to folks, our website, the one website, Mayor, if they could go to one place to get information about literally everything. It's a master sort of everything from health to I lost my job to ask a scientist, test my systems, where can I get tested, to small business relief, covid19.nj.gov, covid19.nj.gov. That bill that Congress passed yesterday is a big step in the right direction. And then I know our folks will be coming out with guidance for the small business community in terms of exactly how they pursue that. But that website's a good first place to go.
And the same with unemployment, right? We just got this website, www.myunemployment.nj.gov. I think that we were about to give that out today. Myunemployment.nj.gov helps people to navigate more unemployment, because some of the issues were that it's backed up, they call and nobody's answering. And that's probably the same reason it's swamped.
100%. And so that's exactly a good website. Also, you can also go on that master website, covid19.nj.gov. So either one of those will work. We have, I believe, Mahan, who's with me, will tell me, I think we have 858,000 people in the past 3 weeks who have filed for unemployment insurance. 858,000. A year ago, the same period, 84,000. So this is historic numbers. I would just say to folks, we know the lines are tied. The waits are long. Getting on the website has not been the easiest thing, and we understand that. I think we made payments, I'm happy to say last week, I believe of 500,000 people got payments. So we are cutting through that backlog, but I'd ask folks to continue to have patience. And also the folks who are answering the phone are probably also going through their own private hell in this current situation. So please all be good to each other. If you have that patience, I promise you this, you will not lose one penny of what's coming to you, including the federal plus up $600 a week money. You'll get all your money, even though you may be frustrated in terms of how long it's taking you to get through. It's getting better, but I appreciate the fact that still the backlog is significant.
Yeah, I understand. Thank you for that. And I understand that you are on the calls with the president or the White House, and that could probably be difficult. Want to see if there's any progress that us in Newark we should at least be leaning on. I think that there's some progress, some productivity in that.
Yeah, I mean, there are, Mayor. And you and I, we're not out campaigning for this president. You and I both know that. But we wake up in the morning with one president. Right. It is what it is. And so we have to find, I have to represent the 9 million folks in the state. The mayor's got to represent the many hundreds of thousands in Newark. And by the way, not just as the mayor of Newark, but a role model for the other mayors in the state. So the leading by example piece here is a burden for both of us. And we have to wear that responsibility. And I would say the mayor does this brilliantly. You got to wear that well. So we find common ground. I was just off a call with the Secretary of the Treasury, and it was a productive call, I have to say, because we're trying to loosen up some money that we got out of the last congressional bill that we've been frustrated in terms of how to get at that money. And the mayor knows this because you put a statement out yesterday. municipal budgets have been blown up. Expenses are still high, if not higher, and revenues are falling off a cliff. And the same thing is true for the state. So in addition to working with the Army Corps of Engineers to get beds, and they've been great, FEMA to test people, to getting ventilators, and we're finally able to sort of hold our own on ventilators, to get that personal protective equipment. We're still out there scrapping for that every which way, including with the federal government, but also to get the money we need. I'll speak to the vice president later on today. We have to find common ground, and we do. We did not come into this, Mayor, and I know you know this, but I want to, for the folks watching, as a nation, we did not come to this moment in history prepared. There's just no way to say it otherwise. The strategic stockpile, our financial firepower, the testing capabilities, we've cobbled together. I think I mentioned this, New Jersey's the 4th highest tested state in America right now with the 11th largest population. We've put that together with bubble gum and paper clips. You know, it's got to be better than this. So it's just a reality, and we're all making do with the hand that we've been dealt. It's not easy, but we're doing the best we can, and that includes finding common ground with the administration.
Yeah. I'm glad you mentioned the budget situation. This Menendez bill and this other stuff, are you hopeful that, you know, we got our fingers crossed and we going to every person we know that can help us figure out how to help them get this thing done? You know, just any hopeful kind of information that you have regarding that.
Yeah, I mean, it's too early to tell, Mayor, but the bill you're talking about, here's good news: bipartisan sponsorship. So Senator Bob Menendez, we've got an extraordinary congressional delegation, and he's our senior senator. And Senator Cassidy, Republican from Louisiana, another state that's been hit really hard by this, particularly in New Orleans, and I think they tie that back to the Mardi Gras. Bipartisan bill, $500 billion direct cash into states and municipalities. That's exactly what we need. Now, I was really discouraged by what Senator McConnell said.
Right.
You know, maybe it'd be a better idea for states to go bankrupt. It's worked in some cases for cities. I can't find one case in the history of mankind where it's worked for a city. Number one, the last city to do it in New Jersey was 1938, and there's a reason why it's been 82 years, because it stinks for everybody, particularly because what you end up doing is you don't go bankrupt.
Right.
But what you do is you gut your services, you gut your workforce, first responders, teachers, the very last things we should be doing right now. I thought that was incredibly irresponsible by him, and I hope part of the reason I was on with the secretary, and I want to speak to the vice president, is we got to be better than that. You know, this is a big moment in history. We have to meet that moment with the same level of bigness, and I pray that we do.
Imagine that in New York after 9/11, they would have told them they should go bankrupt after that, as opposed to giving them every resource they needed to recover.
That's exactly the analogy.
Right. It just doesn't make any sense. In this war, we've lost more lives in this battle than 9/11. It is, you know, just makes no sense that they would try to leave us out on our own hanging like this. So
amen.
Thank you for your leadership on that, and folks around the country who are pushing back against this idea of bankruptcy, which sounds like a good idea to some people, you know, which is really crazy to me.
Amen.
This whole piece about coming outside is important. I have like 2 more questions of people in Newark who are saying that the virus is not real. Right, that you know, we're making this up, that the flu is killed more people than this virus. Can you just help us put that to bed in the city of Newark, please?
Yes, Mayor, I will be glad to. First of all, the flu is a reality. It visits us every year, and people die from it. But the multiples of the amount of folks who are dying from coronavirus and COVID-19 versus the flu, this is now, we've had in New Jersey many years combined more fatalities with this than we have with the flu. And I don't even know what the amount of years. About 10 days ago, it was 3 or 4 years worth of blessed lives lost with influenza relative to what we had already lost with COVID-19, number one. Number two, this is a respiratory illness that infects others through respiratory, including from asymptomatic people. That makes this a very different virus than regular influenza, particularly this notion that someone who's asymptomatic can infect you, never mind those that are symptomatic. Thirdly, this is a big one. We have a vaccine for the flu.
Right.
we don't have a vaccine for COVID-19. So the best case we can have right now is crack the back of the virus, get that healthcare testing and contact tracing up and running, responsibly reopen. Dr. Fauci, who we see on television and I've spoken to privately, by the way, married to a Livingston gal, so another shout out for Essex County, has said unequivocally, even if we do everything right, Mayor, this is the sort of virus that comes back and bites you again in the next fall or winter.
Wow.
So that's part of the reason why we're building our capacity out right now, even if we think we may be in a reasonable shape on hospitalizations or ventilators, we may see this again and again. That's very different than the sort of nature of the regular flu. So this is, sadly, I'd like to say otherwise, this is the real deal. And I'm not saying the flu isn't a challenge, but you go out and get your flu shot every year, you got a good shot of being able to skate through that. We might have a therapeutic in the fall or winter, meaning a drug, not one of these things where the folks will say, well, gosh, this works for malaria, let's try it for COVID-19. But I mean something that's been approved by the FDA explicitly for COVID-19. We might have that 6-9 months from now. We might, please God, have a vaccine a year and a half from now. If you listen to the experts, that'd be aggressive. That would put us, those two steps would put us in a very different and much better place. But until we get there, this is deadly, and people have to take it deadly seriously.
Yep, thank you. I know that this is a difficult time for a lot of us. You know, we're not used to staying inside emotionally. A lot is difficult psychologically for a lot of us. I'm glad that you, your wife, your children, everybody's doing well during this difficult time. I try to, read a little poetry, play a little music for the residents, but also for myself at home, play with my son, do whatever it is I can to pass the time and make sure, everybody is at least emotionally and psychologically well. Yeah. How do you make sure that you're okay, and what do you think the residents out here should be doing to make sure that they're okay?
It's a great question, Mayor, and it's not easy. And by the way, I'll be the first to say we know this isn't fun. We know this is not something folks want to be doing. So there's no amount of ignoring the fact that this is hard work. But what you're doing is, for the folks watching, what you're doing is making a huge difference here, and we need you. Listen, Tammy and I have 4 kids. They're all learning remotely, 3 in college, 1 in high school. So it's a whole new ball game. We will, I also had surgery, so I had to be a little bit careful over the past number of weeks to make sure I didn't overdo it. My part-time reentry was threw that playbook out. Wow. Almost, right? But so far so good as a health matter. But we'll have family dinners most nights. We'll watch a movie a lot of nights, reading a lot. I mean, you and I are on the phone, on Zoom, on Skype, morning, noon, and night. So the job hasn't gotten any easier, that's for sure. But I'm not patting ourselves on the back, but just to say, in the whatever downtime there is, I think folks do need to think about what pleases me. Reading, listening to music that is comforting, that evokes good memories. As I say, we watch some movies as a family. We're trying. We get outside and get some fresh air, but you got to do that responsibly, right? You can't get too close to people. You got to wear a mask. We know that's not fun, but pick your spots. Stay I know we'll get through this. That's the one thing, and I know, Mayor, you know this as well. We're going to get through this. There's no question about it. Sadly, not without loss. We've already had far too many leave us, but we will get through this. And I would just say to folks, stay the course. Thank you for everything you're doing. It is making a huge difference right now. And you're the biggest reason why we'll get through this. We've got extraordinary, heroic healthcare workers. I don't know where we would be without them. First responders, essential workers in retail and warehouse and longshoremen and NJ Transit and whatnot. Together with that army and backing them up and folks staying home and doing what they should do, we will beat this thing.
Thank God.
Amen.
I'm definitely glad that you came on, man. I got to do my couple of shout outs and I'll give you a chance to say whatever it is you want to say when you get out of here. But I also want to, and I always tell people to call over at UH, people who have survived the COVID-19, because they're looking for people to donate blood, because they're doing this plasma testing thing over there for antibodies. That number is 973-972-5474, or one word, COVID plasma, at uhnj.org. Dr. Elmer Hall is a godsend to us over at UH. He's been doing an awesome job. I'd like to thank you for that over there. He's been working with the community 100,000%, has been with us every lockstep, and we're doing what we can to support him. So we're trying to get people to go over there and donate their blood if they have, in fact, went through COVID-19, 3 days without fever, without symptoms, without medicine, and they feel good to go to the doctor, get retested, make sure they give them some blood at UH, because they're doing, like you said, incredible work over there at the university and at the hospital.
Amen.
Eating work. And so we're trying to work with them. Also, yesterday, I gave a shout out to a friend of mine who passed away. His name is Mike Jasper, and inadvertently said that he passed of COVID-19. That's actually, we don't know that yet. So the doctors have not come back with a determination of his death. There's just so many people dying of COVID. People automatically believe that is in fact the case. This is a great guy that we lost, who was a friend of mine, who worked out in the gym, actually trained me before I became the mayor, tried to get me healthy before I got on the campaign trail. And we got together recently, again, right before this COVID thing happened. We were supposed to do some stuff, and then boom, this thing just wiped everything out, and he passed away. But we're not sure that he passed from the COVID. I spoke to his daughter last night. She was upset, rightfully so. And we just want to wish the family well and condolences to Mike Jasper, who's going to be missed in our community. We don't know if he died of COVID yet. The medical examiner has not come back with a determination yet. But anyway, we're sorry we missed him, that he's gone no matter what it is. And all of the young people who have been sending me stuff, videos, raps, pictures, and all kinds of things, encouraging us, encouraging the city. Keep them coming. I love it. We thank you for that. It was awesome. And I'm looking for folks to send me ideas of music to play for Monday. So hit me up. Let me know the music you want to hear on Monday. We want to thank our governor for being here. Give him the last word. And thank him if you can. If there are ways to thank the governor, he needs to be uplifted too in this fight. He's a general in this war that we're fighting. Any way you can give him uplift, please send him, the First Lady, and their children well wishes during this difficult time. Governor, you close us out.
Mayor, God bless you. My thanks is for you, for your leadership. As I said, in peacetime, you set the bar, and in wartime, it's even higher. So bless you and thank you, and Linda and your family, including you got a newborn, which is a blessing. I want to thank everyone for their prayers and support. God bless your friend who passed. He's gone, and and won't be back, and that's a reality that is hard to sink in, regardless of why he's gone. He's gone. So in our prayers for him, and I would also just conclude very simply by saying thank you to everybody. The mayor for the example he sets to the healthcare workers, first responders, essential workers, but explicitly to each and every single one of you, by virtue of your actions, by virtue of your staying home, even when it has not been fun and it's beginning to wear thin on you, which we completely understand. You are making a huge difference in our ability to beat this thing. And from the bottom of my heart, I say thank you, blessings, and thanks for having me, Mayor.
Thank you for being here. I know you've been busy, man. We appreciate you. God bless you.
God bless you too. Thank you.